Have you ever noticed a slight stiffness in your knees when you get out of bed, or perhaps a dull ache in your hip after a short walk, and simply whispered to yourself that it is just part of getting older? What if I told you that those tiny, easily ignored whispers are actually the loudest warnings your body will ever give you, and that by the time most people finally sit down with a surgeon, they have already spent years walking right through the most treatable stage of osteoarthritis? It is a silent progression that millions of us are living through this very moment without even realizing it. But I want you to know something important right now. It is not too late to change the story of your mobility. Growing older does not mean you have to give up your freedom. It just means you need to start using smarter strategies. We often think of arthritis as an inevitable rust that settles into our joints, like an old gate that eventually stops swinging. But that is not the whole truth. There is a hidden culprit, a specific stage of joint health that almost everyone overlooks, and it is usually driven by small daily habits that we think are harmless. In this video, we are going to uncover the 5 critical signs of this missed stage, and more importantly, I am going to show you exactly how to intervene today. We will talk about everything from the surprising foods that are acting like fuel for joint fires to the simple way you move that might be accidentally wearing down your cartilage faster than it needs to. By the time we are done, you will have a clear, actionable roadmap to reduce your pain, improve your balance, and keep those joints moving smoothly for years to come. Before we jump into our first point, if you are someone who cares about staying healthy, active, and independent as you age, please consider subscribing to our channel and turning on those notifications. We are dedicated to sharing the kind of senior health insights that doctors often do not have time to explain in a 10-minute office visit. And while you are at it, I would love to know where you are joining us from today. Are you watching from the United States, the United Kingdom, Canada, or somewhere else? Drop a comment below with your location. It always warms my heart to see how far our community of proactive seniors reaches. Now let us talk about the first thing many of us miss, which is the quiet inflammation stage. This is number 1 on our list because it is the most deceptive. Think of your joint like a piece of high-quality machinery. Long before the gears actually grind together, the lubricant inside starts to change. It gets thin and loses its ability to protect. In our bodies, this often happens because of what we are putting on our dinner plates. You see, as we get older, our systems become much more sensitive to inflammatory triggers. Many of us are eating things every day, like highly processed vegetable oils or hidden sugars in our morning yogurt, that act like a slow, steady drip of acid on our joints. A study published in the Journal of Nutrition found that seniors who reduced their intake of these pro-inflammatory foods saw a significant decrease in joint markers in as little as 6 weeks. Imagine your joints like a campfire. When you eat those inflammatory foods, it is like tossing dry brush onto the flames. You might not feel a sharp pain immediately, but the heat is rising and it is slowly baking the cartilage. Many people report feeling a heavy, leaden sensation in their legs after a weekend of indulgence, and they often mistake it for simple fatigue. My advice here is simple but powerful. You do not need a radical diet, but try swapping out those processed oils for extra virgin olive oil or adding a handful of walnuts to your day. These contain omega-3 fatty acids that act like a cooling rain on that internal fire, helping to preserve the cushion in your knees and hips before the damage becomes permanent. Moving on to number 2, we need to address the muscle symmetry gap. This is a stage of osteoarthritis that is almost invisible unless you are looking for it. When one of your joints starts to feel even a tiny bit of discomfort, your brain is incredibly smart. It tells your body to shift your weight just a little bit to the other side to protect the sore spot. You probably do not even know you are doing it. You might lean slightly more on your left leg when standing in line at the grocery store, or you might push off a chair using only your stronger arm. Over time, this creates a massive imbalance. The muscles on your weak side begin to wither from disuse, while the muscles on your strong side get overworked and tight. This is where the real trouble starts, because now your joints are being pulled out of alignment like a car with bad steering. Think of a door with one loose hinge. If you keep opening and closing it, eventually the other hinge is going to bend and the wood will start to scrape. I once knew a gentleman named Robert who came to me complaining of severe pain in his right knee. After looking at how he walked, we realized his left hip had been slightly stiff for years. He had been favoring it so subtly that he completely wore out his right knee by making it do double the work. To avoid this, try a simple check today. Stand in front of a mirror and see if you naturally lean to one side. Make a conscious effort to distribute your weight 50-50. This small act of balance can take thousands of pounds of unnecessary pressure off your joints every single week. If you are finding these tips useful so far, please give this video a thumbs up. It really helps spread the word to other seniors who might be struggling in silence. And if you have not yet, do subscribe because we have some of the most important points still to come. That brings us to number 3, which is the myth of the morning stiffness. Most people think that waking up with stiff joints is just a rite of passage for seniors, but in reality, this is often a sign of synovial fluid depletion. Your joints are filled with a thick, egg white-like substance called synovial fluid. Its job is to nourish the cartilage and keep everything gliding. When we are inactive, especially during the 8 hours we sleep, this fluid can settle and become less effective. However, if that stiffness lasts longer than 30 minutes after you get out of bed, it is a sign that the quality of your fluid is declining. Think of it like the oil in your car on a freezing winter morning. It is thick and sluggish until the engine warms up. But if your oil is old and dirty, the engine is going to sustain damage during those first few minutes of driving. Science tells us that hydration plays a massive role here. According to researchers at the Mayo Clinic, even mild dehydration can decrease the volume of fluid in your joints, leading to more friction and more pain. Picture your cartilage like a sponge. When it is wet and full of fluid, it is bouncy and resilient. When it dries out, it becomes brittle and easy to tear. My takeaway for you is to drink a full glass of water first thing in the morning and perform what I call gentle oiling movements before you even leave your bed. Simply rolling your ankles and gently bending your knees while lying down tells your body to start pumping that fresh fluid into the joint space. It is a small habit that can prevent years of wear and tear. Now let us talk about number 4, which is something even more common in your pantry that you need to watch out for, the high sodium trap. We all know that salt can affect our blood pressure, but its impact on osteoarthritis is a stage that many people completely miss. When you have too much sodium in your system, your body holds onto water to try and balance it out. This causes systemic swelling. You might notice your rings feel tight or your socks leave deep indentations in your ankles. But that swelling is not just happening in your skin, it is happening inside your joint capsules too. This internal pressure creates a constant, low-level stress on the cartilage cells. It is like trying to close a suitcase that is stuffed too full. The hinges are under constant strain, even when you are not moving. I have seen so many people who thought they needed surgery, but once they cut back on hidden salts found in breads and canned soups, their joint pressure dropped and their mobility returned. Imagine your joint as a balloon. A little bit of air is good, but if you overinflate it, the material becomes thin and vulnerable. By choosing fresh herbs over the salt shaker, you are essentially letting the air out of that overinflated balloon, giving your joints the room they need to breathe and heal. It is not about being perfect. It is about making those small, smarter choices that add up over time. Finally, we reach number 5, which is the loss of proprioception, or what I like to call your internal GPS. This is the stage where your nerves and your joints stop communicating effectively. Inside your joints, you have tiny sensors that tell your brain exactly where your limbs are in space. As osteoarthritis begins to creep in, these sensors get clouded by inflammation. You might find yourself tripping more often or feeling slightly unsteady on uneven ground. This is a dangerous stage because it leads to falls, and falls lead to more joint trauma. It is a vicious cycle. But here is the empowering part. You can retrain these sensors at any age. Research shows that simple balance exercises can sharpen these neural pathways, essentially clearing the static on the radio line between your knees and your brain. Think of it like a lighthouse. If the light is dim, the ships are going to hit the rocks. But if you polish the lens, everything stays safe. A great way to do this is to practice standing on one leg while you brush your teeth, using the counter for safety. This forces those tiny sensors to wake up and work, which in turn protects your joints from the sudden jars and twists that cause long-term damage. It might feel a bit unsettling to learn that so many of our daily habits could be contributing to this hidden stage of arthritis. But remember, knowledge is power. Now that you know, you can make simple changes to protect your health. You do not need to overhaul your entire life overnight. Even just drinking more water or being mindful of how you stand can spare your joints a world of pain down the line. Imagine walking up your porch steps with ease again, or playing with your grandkids without having to worry about how your knees will feel the next day. That is the future we are working toward, one small step at a time. To recap our journey today, remember that we want to cool the internal fire by choosing anti-inflammatory foods and avoiding processed oils. We need to stay mindful of our body symmetry to ensure we are not wearing out one side of our body prematurely. We must keep our internal machinery oiled by staying hydrated and moving gently every morning. We should watch our salt intake to keep joint pressure low. And finally, we need to keep our internal GPS sharp with simple balance work. It is all about giving your body the right environment to maintain itself. Remember, your body is always trying to heal and strengthen itself. All we have to do is give it the right fuel and the right care. Growing older might be inevitable, but growing weaker does not have to be. With these smarter strategies, you can stay strong, mobile, and independent. I know that getting older can feel hard sometimes. The aches and the fear of losing your mobility can be scary and discouraging. But I want you to hear me when I say that you are not alone in this, and it is never too late to turn things around. Every small step you take, every better food you choose, and every good habit you build is an investment in your future freedom. One meal and one step at a time, you are taking charge of your health and your life. Now I would love to hear from you. Which of these 5 points surprised you the most? Have you noticed that morning stiffness, or maybe a tendency to lean to one side? Share your story or any questions you have in the comments below. I make it a point to read through them because we all learn so much from each other's experiences. Your plan to change even one small habit might be the exact inspiration someone else in our community needs to hear today. If this video helped you or opened your eyes to something new, please hit that like button. It truly means a lot to us and helps this information reach more people who need it. And if you have not already, please subscribe and turn on the bell notifications so you never miss out on these science-backed tips for thriving in your golden years. We have so much more to share because your health and your independence are worth fighting for. If you are still with me and you are determined to stay strong and keep your mobility, type a 1 in the comments to let me know you are committed to these small changes. And if you have any doubts, type a 0. I appreciate all of your honest feedback. Stay strong, stay healthy, and remember that your independence is carried by your legs. Keep taking those small steps for your health. They truly do add up to giant strides in your freedom.